back. Well, there now appears to be some evidence now that the province of Gauteng is already in the fourth wave of Covid-19. That province has over 16,000 active cases. Of course, it seems many of those cases may be the new Omicron variant. The person who helps make the predictions for the Gauteng Coronavirus Command Council, he's a mathematical modeler, is Professor Bruce Mellado. Professor Mellado, good afternoon to you, and I really do appreciate the time. I'm sure you haven't slept since the announcement of this. Firstly, at this stage, is Gauteng already in a fourth wave? There's a mathematical definition that you use. Is Gauteng already there?
First of all, thanks a lot for having me again. So, as a committee, we sort of stay away from declarations or definitions. This is more of an academic discussion that we typically don't get ourselves into. So what we do is we basically study the data very carefully and calibrate the models and compare them to the data. So what is clear is that we are in a fourth wave. We're going towards the peak. Modeling has been recalibrated. Now we have, as a committee, a new set of models that have been obtained very recently in light of the new variant that you just mentioned, which appears to be more transmissible. So now all these models accommodate the fact that we have a new reality. So, but the looks of it, the data is well described by the new model. And the model basically is predicting that this week and the next week we're going to have significant increases in the number of cases, and we should be aiming at a peak somewhere second, third week of December, 1 week, give or take.
That's very soon, that the peak would actually be coming that quickly. I mean, that's more quickly than I think many people would have thought.
Absolutely, and this is basically what happens when you have a variant, a virus that spreads more fast, something that spreads faster. So what we have seen in the past 2-3 weeks, and in particular in the past 2 weeks, is that the numbers have grown extremely fast. The speed at which the numbers have been increasing, the acceleration, hasn't been seen before in South Africa. So we have to be cognizant of that fact. We're dealing with something very, very contagious, something that is really going to get to people. And the reality is that once you have something like that, what happens is that the peaks become bigger and they occur faster. So yes, it's going fairly fast, indeed.
If we have the peak in 2 to 3 weeks' time in Gauteng, so the middle of Gauteng, I mean, start of the festive season, but that's a different question. How long do you expect us to be in the peak for? You talk about this variable being highly transmissible. Do you expect a long peak, or do you think the number of new cases could come down as quickly as it goes up?
Yes, that's what happens when you have something more transmissible. So the time that it takes for the peak to wane and the numbers to go down is, of course, less because it took less time to reach the peak. But modeling typically shows that the way the numbers go down is slower than when they go up. So it takes longer to go down than it takes to go up. That's typically the case with modeling, and we've seen a similar situation with a third wave, and all in all, modeling was actually working fairly well. Remember, we faced a very similar situation back in June when all of a sudden the Delta variant emerged as a more contagious variant, and then we changed gears and modeling needed to be redone. Once the model was calibrated, then all in all, actually numbers followed the model fairly well. So we should be having fairly high numbers still sometime into mid-Jan. Now the concern here, and this is really the big problem that policymakers have to face now, is that we are going to be reaching a peak right when many people in Gauteng are going to go outside the province. We're going to have outward mobility. We know that the levels of mobility in the province are very high, the highest since the advent of the pandemic. And then the peak will happen right when people are going to leave the province to other destinations. So that certainly is a major source of concern.
So, I mean, the key question, and the number of new cases is a very important piece of data, but the other important piece of data, and I don't know if it's possible to answer this, is how many of these new cases are going to lead to severe symptoms, hospitalizations, and unfortunately death. Now, that also, I would imagine, depends on, well, I mean, it's very complicated, isn't it? Because it depends on the variant, but it also depends on the vaccination rate.
Absolutely. That's a very good question, a very good remark. So what we see now is that the age composition, the demographics of people hospitalized is significantly different from the first wave, in particular when we were reaching the peak and vaccination rates were low at that time. So what we see now is that people over 60 that have a much higher coverage of vaccination, above 50%, appears to end up in hospital less often than younger people, younger than 40, that have about half the level of coverage. So basically what happens right now is that in hospitals you have an increase in hospitalizations, of course there is, but the increase of hospitalizations, mortality is happening much more slowly compared to the growth of the positives. And that, we believe, boils down to the fact that vaccination is in progress. Now, the fact that the younger people now, the fraction of people that are hospitalized is younger, this means is a result of the fact that the vaccination coverage is not great among the young population.
Okay, so, I mean, in a way, this is encouraging. We're seeing now the impact of vaccinations in protecting people, if I've got that right.
That is absolutely correct. That's our understanding. Also, there's a very important statistic that points to the fact that most of people in hospitals are not vaccinated. So people that are vaccinated are in a small minority among those that are hospitalized. And overall, within the space of hospitalization, the disease is less severe compared to what we had before. So these are strong signs that the vaccines that we are taking are efficacious or highly efficacious against the new variant. Now, we don't know exactly how efficacious the vaccines are, but given the numbers, it's reasonable to conclude that the efficacy is high.
So, as you stated, you don't make policy, you give advice to the people who do make policy. I won't ask you, well, I'll try very hard not to ask you a policy question, Professor, but I do want to let me sort of put the question like this. Is it possible then to also take everything that we know about the variant, about transmissibility, about how quickly the new wave will peak in just 2 weeks perhaps in Gauteng, and put that into a model that will predict how many people we're likely to lose? I mean, from what you say, with the fact that people are being protected by the vaccine, the fact that hospitalizations are increasing more slowly than they did in the previous waves, does that mean that we won't lose as many people as we did the first, second, and third waves?
Relative to the number of cases, indeed, it seems evident that the rate of mortality and severe disease has decreased significantly in a way that's consistent with the coverage. However, as we've already indicated, coverage is still very low compared to the targets that we would like to have had before the advent of the fourth wave. As a result of that, the fourth wave, although it may not be as painful as the third, it is going to be significant. And the fact that the virus is more contagious doesn't help because it's creating sickness much faster. And as a result of that, that basically creates a much faster stream of disease, including severe disease and mortality. So it is a serious situation. We don't want to minimize the seriousness of the situation.
You've got a member of your family, I think, behind you who may disagree with some of your calculations. I do want to ask, Professor, so when we have this kind of situation now, very difficult to know what's going to happen next, but there's also, I think, perhaps a sort of class dimension to it in terms of inequality. My understanding is that it seems the richer you are in our society, the more likely you are to be vaccinated, but it's also the more likely you are to ever be diagnosed as having the disease. So does that skew, does that make it harder to make predictions because so many people don't have proper health care coverage, they haven't been able to get vaccinated, and they might only go to a hospital at the last minute?
That's a very good question indeed, and a very painful one for us, because we are trying to understand these effects of the data, and we certainly have certain insights into that. So what we do, in order to understand and alleviate these social vulnerabilities and social inequalities to really pay a lot of attention to the geospatial picture. We pay a lot of attention to the geospatial picture in terms of positives, in terms of hospitalizations, and also in terms of the coverage of the vaccine administration of the vaccine. In fact, our team, in collaboration with the DCRO, did develop an overarching index that incorporates social inequalities and social vulnerabilities geospatially, so that policymakers could take a look at the regions that are expected to be more vulnerable compared to others. So that aspect of vulnerability in light of COVID-19 certainly is understood, and the corresponding statistics is actually there. So yes, it's something that we do pay a lot of attention to, and that typically goes through understanding the geospatial picture of the pandemic.
Professor Bruce Mellado, as always, I really do appreciate the time, sir. Thank you very much indeed for your time on Newsfeed. Mathematical modeler, member of the Gauteng Coronavirus Command Council. You get the sense there of what exactly is playing out in that province in terms of a fourth wave. Just 2 weeks before it peaks in Gauteng. Well, in a moment, we'll have a look at the state capture inquiries.